Thank you, Member Coates, and a second by Member Duncan. Any corrections or additions? All right, all those in favor, please state aye. Aye. Opposed? And we'll move right into informational items. First is the Board of Health. We have exciting updates.
Good afternoon. I do have exciting updates from the Board of Health. First and foremost, one of the updates in your last packet, you had, I believe, our October Board of Health packet in there, which included a policy decision to discontinue our dental clinic services with OSF. That project is actually continuing, and we are actually moving our timeline up to February. And so we'll be working, and we have been working with our union as well as with our staff and making sure that communication and the follow through of that discontinuation of our program moves forward. We are working with our state's attorney's office as well for the contracts for both OSF and Heartland services. So hopefully we'll have that finalized before we officially open the doors. We are still closing out cure violence programming with our Senate discretionary funds. And so working with Scott as well as with juvenile probations on a potential project to pivot those funding dollars to a problem solving court. And then right now we are moving. So effectively, Thursday afternoon, our first team starts moving out of Human Service Center. This is one of two of our rental properties that we have been utilizing for the past 2 years. So they will begin moving their items into the new building, as well as we'll start a remote access or remote work schedule. The following week after that will be the courthouse team, and then we do have a break over the holidays, and then quickly we'll start moving the coroner site, California Avenue, as well as a highway. EMA will also be moving the same week as the courthouse. We have, thank you to Gretchen, we've had a large communication structure starting as well. So we have these kind of postcards as well as mailers that have been going out, notifying individuals of our new address, and that we'll be starting to see services there January 22nd, as well as communication on who to call for changes in appointments and so forth. I'm more than happy to answer any questions.
Any questions? Yes, Member Blair.
Can you remind me what's the official date you're opening your doors?
We are officially opening our doors on January 22nd for clients. The 21st will be the ribbon cutting ceremony. And so we will be having an open house as well as allowing not only our staff, but other departments to kind of learn about the different roommates that we will be having on site and the services they provide. And then the following day, it will be officially open. Clients will be already scheduled to have their appointments there.
Great. Do you know when's the coroner's office? When will he be functioning out of that?
So again, similar, it's 22nd. So all public services, so for them, that would be even bodies would be transitioning and moving there on the 22nd. And so again, we just want to make sure it's open for full public on that day.
Any other questions? Okay, thank you. Next is care and treatment. Anything?
Nothing to report, Mr. Chairman, other than that we've transitioned the clerical and bookkeeping functions so that county administration is now handling those.
Okay. Maybe we could invite somebody from care and treatment to come in the next couple months and just kind of, I don't think we've had anybody here since forever that I can think of.
Absolutely happy to reach out to the chair of that board and talk to them.
An update about what they're doing and what's going on, and just I think it'd be a good educational opportunity for the members.
Absolutely, we can do that.
EMA. Welcome, Jason.
Good afternoon. I believe you got a report, so I just kind of highlight a few things. We've talked about how I'm getting back to playing emergency manager post-pandemic, so you see a lot of meeting attendance, which is gives me the opportunity to, relationships is the key in emergency management, and the best way to do that is at least initiate some of those relationships is going to a lot of these meetings and then building on some of those. One of them I wanted to particularly point out was our Medical Reserve Corps Community Trauma Team. So prior to the pandemic, we had done some work with Children's Home Association to build a community trauma team that mental health experts that could go out into the community and provide what we call mental health first aid following emergencies, disasters. Some of the activities they were involved in prior to the pandemic were they were called to go to a handful of schools post some incidents at schools, either a death of a student or a faculty member. And so, as like a lot of things during the pandemic, that team wasn't utilized much and kind of fell apart a little bit. And so we've met with CHAIL, or Children's Home Association, and we're going to start rebuilding that team and take a lot of the work we put together and just move forward with that. So I think that's a good example of our community collaborations. Additionally, you'll see in some trainings, one of the things that we've done is we had an open position in the preparedness program. So I now have an emergency preparedness planner, which provides me an opportunity to start doing a lot more activities. So you'll see a lot more training as she becomes more familiar with emergency management. But one of the things we conducted is just a couple of weeks ago, we hosted a respiratory workshop for long-term care facilities to talk about the upcoming respiratory season throughout the winter. And our plan is to start doing that twice a year. In the spring, we'll meet with them again to try to talk about whatever emerging infectious diseases may be affecting our long-term care population. And additionally, with our exercises, I had the opportunity that week of October 21st, I think on 5 different occasions, to meet with some Bradley nursing students. And we went through a tabletop exercise. We talked about emergency management, and then we talked about if a tornado impacted our community, how that looks and what things we may have to do to respond to it. And then to conclude, again, this year I had the opportunity, I was honored to serve on a NACHO with a Project Public Health Reviewer. So I had the opportunity to meet with about, probably 30 of my colleagues. And I was with a team of 2 others, reviewed plans from 3 other local health departments. And so, again, it's a great opportunity for me to get to do that, expand my information and knowledge with what's going on and see what some of the other communities across the United States are doing to prepare. So, any questions for me?
Thank you. Any questions?
Awesome.
All right, thank you.
Have a Merry Christmas.
You too. I think we'll see you again before Christmas.
Well, I don't
No?
know.
Regional Office of Education. Hello.
2 things from me before a report on truancy. Number 1, I can't believe I forgot to put this in your packet, but we were awarded 4 new classrooms for Preschool for All, as was Peoria Public Schools. So Peoria is adding their classrooms onto their Purple Village at Woodruff. So Valeska-Hinton's filled to capacity. They've built an entire early childhood wing. If you've ever had lunch there with the Woodruff Culinary, there's a whole long hallway full of early childhood rooms. We are going to, for now, shoehorn ours into St. Paul Baptist. So we're up to 8 total classrooms now. We are trying to hire staff and scurrying to get that done because we can open those as soon as January. We're not quite ready for that yet. But the other big announcement is the spring celebration of the arts, due to the construction here at the courthouse coming this spring and summer, is moving to your Peoria Riverfront Museum for this year. We're very excited that staff, after we had several meetings to just what is this really going to take? Like, where do kids go to the bathroom? You have to get down in the weeds with this, right? And their staff has been more than accommodating, and we have some exciting things planned for that. So that will be this spring as a temporary location for the spring celebration of the arts. And then an exciting update on truancy. And before I give her the microphone, she forwarded an email yesterday from Norwood. You're always hearing about Peoria Public Schools, or these schools need this. Norwood is one of our limestone feeder K-8 districts. Norwood has shown a 95% attendance rate, their highest in 3 years, because of the work of the attendance specialists, our student support specialists that are going to these schools, meeting with their staff, and taking the referrals. So she has a specific update for you. And then we've decided, talking amongst each other here, not to go through all the data with you because you're getting that in your packet. Instead, maybe a couple anecdotals. So, Kara.
Hello. Like she said, I've provided you all the data. If you have any questions on that, I'd be happy to answer any questions on that. But we have weekly truancy meetings, and we always ask our student support specialists. We start every meeting by asking them if they have any success stories. And so last week, one of our specialists shared this story. Actually, was it last week? I'm sorry, it was this week because it happened right before Thanksgiving. So she said, on November 26th, during a routine home visit, I stopped by to check in with a family with 3 small children, ages 6, 9, and 13. Usually the mother does not acknowledge me, but today was different. Grandpa answered the door and escorted her outside, and as we chatted, I noticed there was a different tone as she told me the children had been very sick. I could tell by the look on her face that what she needed today was to talk about more than just truancy issues. I asked her if there was anything I could do to help during the holiday season. She began to cry and stated that there was no food inside her home and that she needed diapers for her youngest. I knew at that moment that I could help and asked if she would be home within the next 2 hours. She said that she would, and I told her I would be back. I walked to my car and made a phone call to Pam Wiley at the Wraparound Food Pantry. She told me to give her 1 hour. I completed a few more home visits and traveled back to the Wraparound Center to meet with Pam. Pam always comes through when a family is in need, just a phone call away. When I met Pam, she provided me with 4 boxes of food along with the diapers for the family. These boxes included vegetables, fruits, rolls, sweets, and frozen meat items. I was excited to deliver it to the family. I thanked Pam and began to load my car up with all this wonderful food. I got in my car and drove back to Brandy's house. At that moment, I knew I loved being a student support specialist. My passion is helping others and making a difference in people's lives. We are so much more than just truancy. We are a family's ear, someone they can lean on in a time of need. We are a resource that helps people and families. I assessed their needs and immediately put a plan into action within 1 hour. I finally arrived back at the house and knocked on the door with a smile on my face. I asked her to come outside, saying I had brought her something. I went to my trunk and began carrying all the boxes and food with diapers to her doorstep. All 3 children came outside excited and asked to help bring food into the house. They were jumping up and down. Mom began to sob again as I reassured her I was always a phone call away. Mom kept repeating over and over, "You are so amazing." Helping others is my calling. I am proud to help families in need. I walked away smiling, and that is something I will never forget. With Thanksgiving 2 days away, I knew that the family had not only food to eat, but diapers to care for their youngest child in need. As I walked down their stairs to my car, Mom shouted, "I also got a new number. Would you like to take it down?" I did, as I've been trying to get her new number for a few months. I waved back at them and said, "Happy holidays," and pulled away. So just one success story. These are things that our people do every day. We use Loving Bottoms, which is a diaper, they give diapers away. We use the Wraparound Food Pantry. Peoria Foundation has given us 3 $100 gift cards to give to families. One of our student support specialists, Nicole Tankersley, she, on December 17th in Champaign, Illinois, she got NABC rides to donate a car to one of our families. So our people are doing good things. So we really appreciate you allowing us to have them and allowing them to serve our families in need. So thank you.
Powerful. So I'm just excited that we could show you that it is making a difference. For that one family was worth every penny. And sometimes the way back to school is through an empty tummy. So if that's what it takes, then that's what it takes.
It's amazing. Thank you. And while you're still there, while everybody can look at the numbers themselves, but at least note that the home visits from October to November, in October they did 521. In November, they did 1,620. And student parent contacts in October, 229. In November, 526. So they're doing the work.
One thing she didn't share was the other thing that Kara has done is put together an exhaustive packet to one more time go back to these principals and remind them this is how it works. Here are the tools we're using. Here are the door hangers. Here's a poster. Here's all the things to make sure they have it. There's so many things on a principal's plate. I'm telling you right now, the hardest job in all of education is a building level principal. I don't know how they do it. Just keep reminding them. We want these referrals. We've put it all online now. We've changed everything. But to see that principal from Norwood email her, it was an email he'd sent to his staff, and he said, look at our numbers turning around because what the ROE is doing, so we need to do our part. Oh, so you up your game, then they have to up their game, and the families are like, no, we're going to be back knocking on the door again, and you may not answer this time, but we'll be back again. So it's that relentless pursuit, for sure.
Thanks. Any questions? Yes, Member Ricker.
I'd just like to thank you for what you're doing, and truancy obviously is a big, big issue, and I think some of your examples are showing that it's really complex. There's not one answer to it, and so kudos to the work you're doing. Obviously, you're engaging other organizations within the community to help engage into, if it's supplies, whatever it is. So kudos to that. If we can help get that word out bigger and better for other organizations, because sometimes organizations don't have a way to get in the door to these families, right? So you've got a person that shows up to the door. Now you're building a relationship. Now you can bring other groups and organizations around these families. So it's not a one time you stop and say, hey, we're done, we're out of here. You try to lift those families up, in a way that they probably haven't seen in a long time. So again, keep at it.
If they were going to go to the organization or go to the wraparound center, they wouldn't need the help that we're there to. We are going to them and knocking on the door and trying to connect them. Our job isn't to do the social work part. Our job is to connect them to the people that are. And she was sharing this morning at a different group, Youth Services Network panel. Guess why they're not coming to school this week? Coats, hats, gloves, and if you have to walk to school, you don't have all of that, so that's the newest need. Who's got that and trying to make that connection? So.
And I don't know if anyone has heard it, but the ROE has 2 podcasts out now or 2 episodes, and it's all about community connections, and they sit down with local community organizations and have an opportunity to discuss what they do and what they can offer, and it's a good program.
That's one of our podcasts. The other podcast, I'm glad you mentioned it, is the Peoria Resilience Project. That is a specific podcast that highlights to overcome trauma, you need one trusted adult, and that resilience piece, and they've been interviewing those trusted adults. If you know DeMarvis Dixon, he's the freshman football coach at Peoria High. He's the social worker of the football team. They interviewed him, secretaries, cafeteria workers that are there for those kids in the schools. Those podcasts are on the YouTube channel for Peoria Public Schools and on our website. And we're getting ready to work with Roxy, if you know her, the DJ on the radio, to help elevate these to a professional level of podcasting. And we're going to be blasting those out as well. So 2 different communications.
And does that use our equipment that's at Distillery?
We're working on that, aren't we, Mr. Sorrell?
Yes, we are.
Okay, fantastic. Thank you so much for everything. Lost track where we are here. Sustainability, and Becca is out today, but Scott was going to give a quick update.
Just a couple of quick things to highlight beyond what is in Becca's report in your packet. First, Holiday Light Recycling is underway. We've started this program internally in 2011. We expanded it to the community in 2013. Since the start of the program, we've collected over 5,200 pounds of Christmas lights to be recycled, 1,400 of which were just last year alone. So the growth curve in terms of collections is moving upwards. There's a public drop-off here at the courthouse, and there are a variety of community partners as well with that program. Second thing just to highlight is the Regional Food Council meeting, which will be Friday of this week at 8:30 at Distillery Labs. The topic for this this meeting is policy and planning with speakers from the Stewardship Alliance and the Illinois Institute of Rural Affairs. Happy to answer any questions.
Any questions? Yes, Member Salzo.
Scott, I attended the Retired Teachers Association meeting on Monday, and our recycling program came up in regards to the Christmas lights. And a question was asked, and I couldn't answer it, and the guy that had spoken about this program and so forth, he didn't answer it either. Do we take all light bulbs? In other words, just these light bulbs in here, for instance.
So our Christmas light recycling program is just limited to Christmas lights. We don't accept fluorescent or other LEDs that aren't somehow related to Christmas lights. There are other recycling opportunities in the community for those types of lights.
It's mostly the wire that they're after. It's not necessarily the bulb. So I believe like LED or incandescent or just regular ones, I think they'll accept either one. But it's mostly the wires that they're interested in recycling. Any other questions? Any public comments? Miscellaneous? I just have to quickly thank Member Coates. This is our last meeting with her as the vice chair of the committee. And she was the Bert to my Ernie, the Thelma to my Louise. It's been truly a pleasure serving with you, and I got to witness her advocating very hard for her constituents and the people of the county. So thank you for everything, and wish you well on your next assignment, and welcome Member Blair as the new vice chair of the committee. So, all right, we're adjourned. Thank you.